So good evening, respected seniors and my friends. At the outset, let me thank Dr. Ajayan and his team for giving all of us an opportunity to share our thoughts on this virtual platform. Our association has become a big family now, and it is a pleasure to be a part of this family. The topic which is given to me is misuse of PDE5 inhibitors by youngsters. This is my biodata. Basically, I'm a general and laparoscopic surgeon and a laser surgeon working at Sholapur, Maharashtra. And I'm into sexual medicine since last 2-3 years. So I'm quite junior in this field. So pardon me for any mistakes which I'll be doing in this presentation. So basically, I'm working as a director and a sexual medicine consultant at Super Speciality Sexual Health Clinic and Counseling Center at Sholapur, which is in Maharashtra. Next, please. So friends, we all commonly see young individuals coming to us requesting us to prescribe something which will boost their so-called sex power. I don't think anyone in this August gathering has not faced such an occasion. Many of them are college-going students enjoying sex with their girlfriends. Usually they are physically fit, having normal erections. Majority of them have some fancy concepts. Many times they want to prove themselves as Superman in front of their girlfriend or girlfriends or their colleagues. All of them, they have heard some fancy stories from their friends or family members, or maybe many times they have watched pornography and strongly believe in those concepts and want to copy the same. Of course, as a good ethical allopathy practitioner, we don't fall prey to this, but they find out their own way and get the drugs they want to. It is definitely interesting to know how do they land in this. The most important reason why they land in this is the strong belief that these drugs, that is PDE5 inhibitors, can increase their libido and improve their sexual performance. Majority of them, they start experimenting with these drugs at a quite young age, and the number of percentage of students or even youngsters who are doing this is 45%. Many times it starts with curiosity, or sometimes the friends, they visit a brothel and because of peer pressure, they start consuming these drugs. They many times want to impress or satisfy their sexual partner so that she will feel that he is a macho man. It happens that sometimes the person is meeting his girlfriend after a long time and wants to impress her, or sometimes an officer who is traveling to some other place along with his secretary wants to enjoy the time maximum, and that's why they consume PDE5s. Many times some of them, they have sex with multiple partners and then they want to withstand that for a long time and so consume PDE5s. Later on, these people, they develop a psychological addiction to these drugs and then they become dependent and continue consuming drugs. Basically, what they're expecting out of PDE5s is a miracle like this, what we see in this picture. Next slide, please. Now, basic reason is why they want to do it. What happens is they have so many dreams and they want to fulfill all those dreams using these drugs. What they feel is these drugs will increase their libido, increase their erectile sensation. They want the penis to be more rigid and want to increase the duration of erection as well as their intercourse. At the same time, they want to reduce the refractory period so that they can have sex at multiple times, increasing the coital frequency. Sometimes they do consume these drugs just to enhance their self-esteem, to decrease their performance anxiety, and they want to prevent their sexual failure. Sometimes they are already into some addiction, commonly that of alcohol, and to counteract the effects of such drugs or alcohol, they may add these drugs to this combination to attenuate their erection. Next, please. Many of them want to increase the fun, and that's why try and combine alcohol very commonly with these drugs. As per the standard saying, alcohol stimulates the desire and takes away the performance, but they don't realize it and go on increasing the dose of sildenafil. So that's a common story. Even kath and tobacco also are common accompaniments to these drugs. And last but not the least, chemsex, which is altogether different topic, and I'm going to discuss it in little brief in next few slides later, because this is entirely a different group of drugs which is being used. So may I request you to please go to the next slide. Unfortunately, we have never realized the magnitude of this problem. Sildenafil has become one of the most commonly prescribed and abused drugs available today because it is being used as recreational drug, and many times it is mixed with some other drugs. As a recreational drug, it is being used since it was introduced, that is 1998, and this sildenafil is the leader amongst the PDE5 inhibitors still today. Even the textbook of pharmacology by Dr. K.D. Tripathi mentions that sildenafil is erroneously perceived as aphrodisiac, and that is the main reason of its abuse. Next, please. I know we are here only to discuss PDE5s, but we just cannot neglect the great variety of Ayurvedic products, more than 300 brands available in the market. The quantum of sale of these products in our country is astonishing, and many of the products can be classified into 5 commonly used products like Safed Musuri, 303, Salam Punch, which is many times mixed with Afim, Kavach Beej, and Shilajatu. The one which was being sold as Tentex Fort was quite famous and had a very big share of the market, was probably in between mixed with sildenafil. Shilajatu, which patients commonly consume, basically the original product is not available, but they use something else as Shilajatu. And Ashwagandha and Shatavari, of course, are very commonly used. Next, please. Now let us know what is the attraction for these youngsters for this misuse. Unfortunately, we don't have Indian data, but in US, this is a major public health menace right now in sex medicine. 30 million patients of erectile dysfunctions are there in USA, and more than 1 billion doses of Viagra are sold in USA. Why the students or the youngsters get attracted to these drugs is many times they see such television advertisements. They, of course, are very busy in social media and then day to day watch the advertisements. Sometimes they see their family members consuming the drugs and having sex. Even some of the youngsters are found stealing the tablets from their father or grandfather's collection. Sometimes they find their friends doing it, and whenever some sporting events are arranged, these friends, they come together and then they get attracted to these drugs. Next, please. So what are the resources available for them to procure these drugs? Many of these youngsters, they are usually going to gym to build their body. Many of the gym trainers are already prescribing them testosterone or some protein supplements, and these gym trainers also provide them with these tablets. Nowadays, online pharmacy is become very easy to get the drugs, and that's why ordering it online and getting it is quite easy for these two people. Over the counter sell, which is another menace in our country, they get the drugs very easily. Even the drug is available at some pawn shops. Of course, there are some quacks who purchase and give these drugs to these youngsters. And sometimes it happens that they go to some doctor, they get the prescription, and then they continue it for a long time. Whenever I did some research at my local level, at my place, Sholapur, I found it from the pharmacists that practically they are selling 40 strips per month to such youngsters. And the sale was commonly seen in near the pharmacies which are there near the red light areas. And the commonly used drugs were Suhagra, Penagra, and Penagra Express. And what I realized is many times these youngsters, they consume more number of tablets at a time. Next, please. Next, please. As I said earlier, this topic, chemsex drugs, will need another webinar, but I would like to touch it in brief because the recent journal in 2017 of neuropharmacology says that all these PDE5 inhibitors are also part of these chemsex drugs. Now, what do we mean by chemsex drugs? It is the voluntary intake of psychoactive and non-psychoactive drugs in the context of recreational settings to facilitate and or to enhance sexual intercourse. Now, this is commonly done especially when the men want to have sex with other men, what we call as MSM. This triggers their feelings of excitement and facilitates intense feelings of sexual arousal. Next, please. As I mentioned earlier, the current neuropharmacology mentions sildenafil, tadalafil, and vardenafil as chemsex drugs. Apart from that, we all know that there are various drugs which are being used by these youngsters like bubbles, crab, or meow meow, then methamphetamine known as chalk or crystal meth, then GBH, GBL, ecstasy or MDMA, and what is commonly used nowadays, especially in the rave parties, is the poppers, also called as Rush, Bolt. There's so many names to it. And these drugs again are commonly used by men who would like to have sex with men because the anal penetration becomes easier because of relaxation of the voluntary muscle, smooth muscle. There is decreased pain perception and mild hallucinatory sensations, giving the visions of bright colors, and this often makes a symbolic representations of sexual movement, and that's why these drugs are commonly used for sex. Next, please. These drugs are also called as SUIDs because in such under influence of such drugs, the sex is carried out. Again, it is commonly done by bisexual and homosexual individuals, but we are not aware of the magnitude because there is a shame and stigma often associated with such drug use, and that's why it is not being disclosed to the society. But these people face high risks of infections and HIV transmission. Next, please. As I said, commonly seen in MSM community, out of these, 10% of the men who have sex with men use Viagra, and they engage sometimes like in the unprotected sex, and the frequency is 6 times higher than that of the normal sex. 40% of HIV positive men are reported using these drugs for having sex, and 54% of the users, they mix Viagra with other drugs for having MSM. Next, please. Now, what are the problems with these chemsex drugs? Can we move that window away? Is it possible, sir? Now, what happens with after use of these chemsex drugs is these youngsters, they lose their capacity to choose their sexual partner and consensual sex. They continue this sexual activity over a protracted length of time, and many times, back please. Yeah. Many times these intercourses are condomless, and that's why the chances of having penile abrasions, vaginal and rectal trauma are quite common. And of course, there is significant increase in chances of transmission of HIV, gonorrhea, and many other STDs. Now coming to the solutions. How are we going to deal with this problem? Most important, I feel, is the public health education. And it is the duty of the healthcare professionals and pharmacists who should counsel the users on how and when to use the medication. Also should explain them the risk of getting common side effects as well as becoming psychologically dependent on these drugs. We should advise them to use only when it is necessary because of its addiction liability, and users should also be made aware of the impact of using the same drug with other illicit drugs. Next, please. Like we label tobacco, like we label cigarettes or BDs, we should also label these drugs some warning to the users, like an increased risk of STDs, including HIV infection, increased risk of becoming psychologically dependent on these drugs, which will lead further to psychogenic based erectile dysfunction. I think this warning should be there on these drugs. Next, please. And many times this problem commonly goes unnoticed, especially in sports events. And that's why WADA, that is World Anti-Doping Agency, they should ban using these drugs by athletes. It is found that many healthy athletes use these drugs to improve their sporting performance. So I think that should be banned. Next, please. And of course, there is a need that the FDA, the government regulations, should strictly control the availability of this drug on the counter. It should not be given to the youngster, especially without a prescription. And the utilization of the drug also should be monitored along with the cell. So that I think our association can request to the government. Next, please. So friends, thank you. Thanks a lot for a patient hearing. And I again thank ISAMP for allowing me for this presentation. Thank you. Thank you very much.